Hello and welcome to Digital Life with News18. A top scientist, a former ICMR scientist, in fact, has said that chances of a third wave are very low, and that even then, it's a fact that we're seeing that children are not going to schools and they shouldn't be rushed in. Himani, in fact, had done that interview. She's joining us, and so is Shaina. Both of them cover different aspects of the pandemic. Shaina covers education, and Himani covers health. Himani, if I can come to you. So the scientist says that chances of a third wave coming are very low. Why do they say that? And as far as children are concerned, we're seeing a very low turnout already.
Right. So, Runjun, I would like to divide it into points. Dr. Raman Gangakherkar, who was also the face of government in the press briefings last year for COVID-19. So he listed some points. He said that, many of us have already got antibodies through natural infection, that most of the population has already been infected with COVID-19 already. So we have antibodies. Then again, he said that vaccination drive is also going on, due to which, at least first dose has been reached to many people, or we are in process of getting at least the first dose. That will also give a certain level of protection. And the other thing, which is very important, he said that there is no such variant in the side that can possibly cause third wave. I'll quote him here to give better sense to our viewers. He said that the newer variants of interest, lambda, mu, and C.1.2, appear to be mutating rapidly but are yet to stabilize to gain fitness better than Delta. This means that the variants which are circulating right now are not stable, they are not fit enough to cause infection and cause possible third wave. He also said that the symptomatic reinfection rate is very low, around 0.2%, which means that chances of reinfection, of having COVID again, are very low. So these are the possible points that he has listed, because of which he believes that the chances of third wave are either very low, or probably third wave may never happen if any new stronger variant will not emerge.
Sure, I'd like to add something to that. And also because the government maintains that as far as the pandemic situation in the country is concerned, we are still in the midst of a second wave. Every day we're still reporting about 30 to 40,000 cases. So the government says that we're still in the middle of the second wave. But important point to note here is that the coming few months, October, November, December, are full of festivals. There's the Shera, there's Diwali, and many other festivals. And if COVID appropriate behavior is not followed, we perhaps could see a rise in the number of cases that are being reported. But China is going to give a sense of how parents and children, in fact, feel about this. There has been much debate around how a third wave could possibly impact children more than it has in, say, the second wave or the first wave. And we're seeing a lot of hesitancy, children still being apprehensive, their parents being apprehensive about going to school. Shana, is there a percentage that you can quote in urban areas or in rural areas of students who have actually started going to school?
Yeah. So
I think we've lost the connection with Shaina. We'll try and fix that. But Himani, you cover the health field very closely. The health ministry, the government has time again pointed out how it's important that all teachers, para teachers, support staff in schools need to be vaccinated before children can be sent back. We've seen many experts come out and say that perhaps it's time that slowly, in a phased manner, children should start going to school. Then there's Dr. Ganga Kelkar there saying that there's no need to push students, there's no need to rush in. Why do you think that is?
So he has pointed towards some latest studies that show that, while children have a stronger immune system, they have the innate immunity. But he said that there are some studies that show that children, despite of mild or asymptomatic disease, they also have been suffering from the post-COVID side effects, or what we call long COVID. He pointed towards a study which had a sample of over 6,000 children, and they reported, even 3 months after the infection, headache, tiredness, and shortness of breath, and many other symptoms. So, basis on this, he said that, we still are learning a lot about COVID. We still don't know much about it yet. So we shouldn't rush into any decision. He did not say that schools should not open. He just said that the decision should not be taken at the central level. Rather, this should be taken at district administration level, where district officials should take a look at the number of infections in a certain block, and basis on that, they should take a decision whether to open the school
Yes,
or
in
to
fact, that is the thinking within the government. I remember speaking with the education minister a while ago, and he also pointed out that states need to take a call depending on how burdened districts are, and so on and so forth. Because at the end of the day, they have a better assessment of how the virus spread is in their state in particular areas. But China, you were talking about how parents and children largely remain hesitant in going to schools.
Yeah. So parents are hesitant in sending their kids to school, but the kids are very much interested, especially the ones who are in 9th to 12th standards. These are senior standards, and these kids are also preparing for entrance exams, or will be preparing for entrance exams in coming year or months, depending on the classes. So these kids want to go to school, and they also miss the connect with teachers and kids, and their emotional learning is being hampered. A lot of parents are also, apart from the physical health, concerned about the mental health. But they are still not going to school, considering that a lot of schools don't have the apt infrastructure available with them. So the cleaning and sanitation costs are additional for schools, which are already running on low fees, sometimes in some cases as low as 50% fees, especially in private colleges, because and schools, they don't have funds coming in. So this additional fee they have to set up the Wi-Fi, they have to set up open plannings, and if they are running multiple batches, the teacher has to come again and again, and the sanitation has to be repeatedly conducted. So these are all additional charges, and the fee are uh, coming, their revenue, which is their primary revenue, is lower, but their expenditures have gone high. So the infrastructure is not there, at least not in small scale private schools. Kids who are actually going to schools are those who do not have access to either devices or internet, or the kids who are either first generation learners of their family, who don't have support back home, that they'll get the support of a parent or somebody elder to teach them and train them. So if we talk about government schools, they have about 70% and above. This is the data coming from most of the principals. Their attendance rates are high. But when we talk about private players, so their attendance rates are comparatively low, because these kids have access to online learning, and they also are not. When it comes to small scale private schools, they don't have infrastructure in place to have. Parents are also concerned that there
Yes,
might not be ventilation
yes.
enough.
China digital divide has been a big concern as far as the education sector and the way it's been hit by the pandemic. That's for sure. But now, slowly, we're seeing that since the government and many experts are trying to push for reopening of schools, and of course, in a very phased manner, uh, one question that all parents keep asking is, when are the vaccines for children coming? In fact, just before this live, I got a call from a colleague whose children, a daughter and a son, go to primary school. And he was eager to know when are the vaccines coming, because there's been a lot of talk around it. But reality is that for now, the vaccine for kids are far away. Yes, for adolescents, we will see vaccines very soon. But Himani, what are you learning? How much time? What is the sort of timeline that parents should watch out for as far as vaccinating their children is concerned?
as far as we understand from the government, they are expecting Bharat Biotech's co-vaccine for children soon as, I mean, from next month only, they are looking at the possible rollout by the end of the next month. I'm sorry, from October. So let's see if that can happen. Otherwise, for adolescents, of course, Zydus Cadila would also be available. It all depends on by when the companies will be ready to roll out, but government is expecting the approvals by next month.
Is this something that you hear a lot, China? Vaccine for children.
There is a lot of buzz. Parents are willing to get their kids vaccinated, but there would be a lot of convincing that would be needing. A lot of data would have to be shared. A lot of campaigns. I mean, from the government side, because when it comes to an adult, they might be okay with getting vaccinated, but when it comes to your children, a lot of parents are very protective that what is going inside my child's body, what is about their health. They need a lot of convincing to do. But there is not no anti-vaccine or any sort of hesitation against vaccination is not there. A bit of
Do you
convincing would just make it go.
do you hear a lot of parents and perhaps teachers as well as schools talk about a possible third wave and them wanting to wait it out first before schools finally open in a full-fledged manner?
Yeah, their schools would have to wait because even if people are vaccinated, even if teachers are anyway, most of the teachers are vaccinated because there was one priority vaccination drive conducted for teachers and teaching and non-teaching staff. But even after vaccination, COVID appropriate behavior will have to be followed as per my understanding. So, of course, what we know, what schools used to be for us will not be the case anytime soon for these children, at least not for a year or so. And a lot of playing together, eating lunch together, mixing and talking and all these friends and teenage and happy stuff that you associate with school, which is beyond academics, that might take a bit of time to happen. But kids have already started online groups, online chats, virtual workshops, virtual libraries and labs and experiments. All of this has been shifted to social media and virtual places of even festivals and fairs and convocations are being done online where kids morph their pictures and take pictures together. So all these fun activities are taking place online, but of course they would want to as soon as we can. Both parents, kids, and teachers
Of
want to
course,
do.
of course.
Yeah.
It's needless to say that in the post-pandemic world, education will somehow change, if not forever, at least for a few years. I had a word with Dr. Balram Bhargav, the Director General of ICMR, yesterday. He's a big supporter, and in fact, one of the very first voices that supported opening of schools. He basically said that when schools open in a phased manner, of course, in a slow fashion, it's important that every single day, at least for 10 minutes, teachers will have to sit them down and sensitize them about COVID appropriate behavior, about COVID and how it has changed life and how their mannerisms and so forth in schools will have to change. Because now, as my understanding is that as far as the seating is concerned, it cannot be the same. There'll have to be, a gap of two seats. When children are sitting, they'll have to be wearing masks all the time. Sanitizers are going to be a part of, their kitty, like they'll have their bags and their pencil box, and then like one kit where they'll have sanitizers and masks and so on and so forth. Um, but have you come across parents or kids who have spoken about how their mental health has been impacted as far as the pandemic is concerned? Online education is not the same thing. You don't meet your friends. You stay within the four walls of your house. It has an impact on you. UNICEF, for example, has said that the pandemic and the closure of schools has impacted children in more ways than one, and also mentally, China.
Yeah. So when the COVID started and when classes started happening online in 2020, teachers were replicating the model they used physically in online classes, at least for the starting few months, which took a toll on kids in the sense that even as basic as their eyes would, water up, their backs they would not be able to sit for longer duration. because parents and teachers earlier used to, before COVID, phones and laptops were not as accessible to kids, or they were asked to stay away from them for longer duration of times. So first, when we replicated when academia moved into online learning, it was replication of physical classes, but eventually with a lot of small, disease तो नहीं कह सकते, difficulties in terms of coming from kids, we kind of adopted that there'll be shorter duration of classes, there'll be breaks in between. A lot of states had their own guidelines put in place, and even boards had their guidelines put in place of what to do and what not to do. Even if you talk to any, in my conversation with doctors from reputed hospitals and chains, and even parents have observed this change in behavior of their children, that they don't want to socialize as much, they don't go out as much, their screen time has increased, their anxiety levels have gone up, they change, they are not sharing, they are not opening up much, and they get very angry, or mood swings are very common among kids. And you, when it comes to a child, these are smaller behavior changes which you say, Acha, their mood is not really good, but at a deeper level, this is anxiety coming in, and which is not good for a longer run. So
Yes.
this is
Yes.
very foundational for children.
Yes. Imani, now your interview with Dr. Ganga Ketkar indicates that the chances of a third wave are very low. But if you could, for our viewers, give a quick update of the situation of the pandemic of the second wave right now, what are the states that remain to be a cause of concern?
So I'll start with, though Dr. Ganga Khedkar believes that chances of third wave are very low, he has already put a disclaimer. He has said this very clearly, and I'll repeat that despite the cases very low, despite the number of infections low, and despite the chances of having third wave low, we must follow the COVID appropriate behavior. Following that, he said that probably, COVID will also end up like an influenza virus, which came as a pandemic, but now this virus circulates in our regular environment, and we just catch cold and minor flu because of that. So he believes that one day will come when COVID will become that kind of an influenza virus. As far as his insight is concerned, he said that there are some states where the antibodies level were low as per the Sero survey as well. For instance, in Kerala, the antibodies according to the fourth Sero survey were around 40%. So because the antibodies in the population were low, those will be the states where we will keep seeing the outbreaks where the antibodies are low. The states where we have achieved maximum level of antibodies, for instance, he said Madhya Pradesh, where the antibodies were found to be in above 70% of the population, the chances of outbreaks in these states are low. So, going forward, we may keep seeing the focal outbreaks, but not a nationwide outbreak of any, further waves, probably, if we are talking about the present variants.
Yes, and adding to what Himani is saying, while the chances of a third wave are low, and while even if a third wave comes, many experts believe that it may not come with the severity that the second wave did, because many of us have antibodies, a lot of us are vaccinated, and that, of course, gives us a shield from getting hospitalized and mortality, of course, and so on and so forth. But having said that, extremely important, the next few months, the months of October, November, and December, we're going to see a lot of festivals. There's going to be Deepavali, there's going to be Dashera, there's going to be Christmas and New Year, and this is the time where we see a lot of mass gatherings. This is the time that possibly the virus could breathe if masses are collecting together, if they're not following COVID appropriate behavior, if they're not wearing their masks. And which is why from CNN News 18, we'd like to tell our viewers that it's important. And I'm going to quote Dr. Balram Bhargav here, that if we celebrate festivals in a low key this way, then perhaps we can celebrate the festivals in a bigger way in the coming next year. Thank you very much for watching.